Good evening. I'm psychiatrist Jay Fulver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 26th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 969-2720, or if you're calling any place coast to coast, you may dial toll-free at 866-969-2720. And I'll start tonight's program with an email that I recently received. It reads, "Dear Dr. Fulver, my son shoots free throws really well in practice. He tenses up and is inaccurate during games. Can people overthink when shooting free throws?" Absolutely, they can. There was a book titled Flow that was written by a Russian psychologist back in the 1970s, 1980s, and in that the book, it described the ability to focus but yet be highly productive, and athletes can get into the flow and be very productive. And I think since that time we've come to understand how the brain works a bit better from a neurobiological standpoint. You tend to use your automatic motor memory when you're relaxed and you're in the moment, you're focused, but yet you're not overthinking. And when your son is shooting free throws in practice, well, he's using this inside part of the brain. So this is half the brain looking at you here. The inside part of the brain is kind of the automatic type of part of the brain that we use when we're walking, when we're breathing. There are some people who overthink their breathing and they start counting their breaths and they think, oh no, did I breathe 14 times or did I breathe 16 times in that past minute? And when they overthink, they actually get more anxious and they force themselves to exhale, and then they inhale and they exhale and they think about it, and it causes a lot of anxiety. When you overthink shooting free throws, you use a different part of your brain. So in your son's practices, he's using the inner part of his brain, and it's just automatic. He's just shooting one free throw after another, very relaxed, but he's focused. But when he's in games, he's over-focusing. When you overthink, you hijack that middle automatic memory part of your brain, the automatic motor memory, and you start using the thinking part of the brain. So you think, okay, I've got to hit the middle part of the hoop, I've got to take it over the front part of the rim, and you start thinking and thinking and thinking. We'll put on top of that the pressure of the crowd. You might have a home crowd in front of whom you don't want to embarrass yourself, and then you have a very loud opposing crowd, and you might start thinking about them. So in doing this, it's distracting you from just the automatic flow of your motor memory when you're shooting free throws. So the best thing to do is either do it the same time every time so that it's very automatic that way. Steve Alford with Indiana University back in the 1980s, Larry Bird back in the 80s and 90s, they always shot free throws exactly the same motion, the same pattern. And that's one way to get into this rhythm of flow. But another way is to hum something to yourself or even sing something out loud. Now, you can sing something you don't have to think about so much, but sing something like Happy Birthday, the Star Spangled Banner, something that's very familiar to you, because that allows your brain to then not overthink what you're actually doing. And that goes for shooting free throws, bowling, golf putting. A lot of people ask about putting because when they are putting, they have trouble with overthinking and they get all tensed up. I remember back in the 1980s, Purdue had a pretty good basketball team back then. Gene Keady was the coach. But you could see when they got on the free throw line, they'd get really tense. And you could see it in their face. They'd overthink, and they had a horrible free throw percentage. And I came to find out that in practice, they were punished for missing free throws. So I was a young psychiatrist at the time, and of course, as a young psychiatrist, I perceived that I knew everything. I've since realized that there's lots that I don't know, and you start to realize that more as you get more experience in general. So as a young psychiatrist, I wrote Gene Keady, and I said, look, they shouldn't be punished for missing free throws. They need to be able to relax, and I talked about some relaxation techniques they could use. Gene Keady, the coach at Purdue, wrote me a very cordial letter upon responding and basically said, thanks for supporting the Boilers. The Boilers, they went on that year and continued to shoot poorly in their free throws. I don't think he took my advice. But the bottom line is the whole idea in shooting free throws is to have this relaxed muscle memory and not overthink what you're doing. Because when you overthink what you're doing, you hijack basically the natural muscle memory that you've developed in practice. You've already had that muscle memory there. You shouldn't have to go to the free throw line in the middle of the game or during a pressure situation and think through how you're going to shoot the free throw. And I see this when I watch all levels of basketball, whether it's high school, college, pro basketball. I see the player get on that line and you see them focusing on that basketball rim, and they're really concentrating, and it might take them several seconds to look at that rim. And a lot of times you can just tell they're going to miss because how tense they might be. The best free throw shooters are the ones that just go up there, shoot it in a very natural manner, and be done with it and run off the line. Thanks for your email. Let's go to our first caller. Hello, Dean. Welcome to Matters of the Mind. Dean, you want to know about fluvoxamine. Does fluvoxamine, also known as Luvox, does it cause frequent urination? It might. It's a selective serotonin reuptake inhibitor. As a SSRI, it might cause more frequent urination. I've heard about that with some people. It's kind of rare, but if you're the one out of 1,000 where you might have more frequent urination with fluvoxamine, you're still the one. So what I'll often advise people to do with a medication like fluvoxamine, if you think it's causing more frequent urination, be aware that, yes, it could, but be aware that there might be other factors causing frequent urination as well. For instance, a medication that's commonly used is lithium. Lithium might be used along with fluvoxamine. Lithium very commonly causes more frequent urination. You might have diabetes. Now, when people have diabetes, they'll have more frequent urination. Perhaps you're drinking more caffeine or more fluids than usual. That will give you more frequent urination. And a urinary tract infection will give you more frequent urination. Enlarged prostate will give you more frequent urination because you can't empty your bladder. So there's many different things that can increase your frequency of urination. Fluvoxamine being a medication that if you started it at a certain time and you had more frequent urination, and especially if you're able to go off of it for a particular amount of time, it goes away, that could be attributed to the fluvoxamine itself. But fluvoxamine is a medication that's also known as Luvox, and it's used for obsessive compulsive disorder. It's an SSRI. It was never FDA approved for depression, as are its chemical cousins such as Celexa, Zoloft, Lexapro, and Prozac, and Paxil. But fluvoxamine is different from fluoxetine. Fluoxetine is Prozac. Fluvoxamine is Luvox. They're quite different in what they do. You had a follow-up question. Why was fluvoxamine used as a COVID treatment? Did a lot of people have OCD when they had COVID? It wasn't used for OCD when people had COVID. When people had COVID, what happened was that the COVID virus would get to their lungs and cause this state of inflammation, and that would make their lungs more kind of leaky, and they'd actually have more congestion that way, and that's why people died from COVID. Their lungs got more leaky, more fluid build up, and it was from inflammation. Fluvoxamine has an interesting and fairly unique feature in the sense that it stimulates these receptors called sigma-1 receptors. Sigma-1 receptors basically are in the neurons and they decrease inflammation. So here you have COVID, which will cause inflammation of the lungs, a severe inflammation of the lungs. In using fluvoxamine, people were able to decrease inflammation in the lungs. So it wasn't uncommon. People would take 50 milligrams every day, and sometimes family members would say, why is this person on a medication used for OCD when they have COVID? It's because fluvoxamine was effective in relieving the inflammation that's seen with COVID infections. Now, it's thought that one of the reasons why fluvoxamine is a pretty good medication for OCD is it can relieve the inflammation associated with OCD as well. So with OCD, with depression, with various psychiatric disturbances, there is an inflammatory effect in the brain. And when the brain gets inflamed, you'll have certain symptoms come out, such as slow movements, you'll have difficulty with thinking, concentrating, you'll have difficulty enjoying things, and you'll have trouble with fatigue. So you hear about all these different symptoms that seem to be going along with inflammation, and it's suggestive that a medication that has a sigma-1 agonist effect or a sigma-1 stimulating effect can help with inflammation. Fluvoxamine being one of them. There's a newer medication out called Auvelity that specifically has this chemical in it called dextromethorphan. That also is a sigma-1 stimulator, and that can decrease inflammation as well. So there are certain medications that we use for one reason or another, but we might use them for other reasons because they have added benefits. And that's why fluvoxamine was used for OCD, but it could also be used for a COVID infection as well. Dean, thanks for your call. Let's go to our next caller. Hello, Bill. Welcome to Matters of Mind. Bill, you want to know, how does amyotrophic lateral sclerosis affect your mental functioning? Basically, Bill, you can stay very sharp. ALS does not tend to cause a dementia. Unfortunately, it's a spinal cord condition where it affects your peripheral body. So it affects your arms, your legs, your thoracic movements. People sometimes will then eventually have trouble breathing. But people will get depressed with ALS, not uncommonly. Excuse me, but they will not have difficulty with psychosis, and usually their memory stays very intact. There's a book that was written, Mondays with Maury, I believe it was, a long time ago, and a very, very good book about 40 years ago. And basically, that was the whole concept of the book, reviewing a person's life history while they had gone through the latter stages of ALS. So ALS does not tend to affect the mental functioning as much as it will the physical functioning overall. Bill, thanks for your call. Let's go to our next caller. Hello, Jane. Welcome to Matters of the Mind. Jane, you want to know if anxiety can cause rapid irregular heart rate and high blood pressure. It can to some degree, Jane, but when I hear about somebody having anxiety and they have an irregular heart rate and they have high blood pressure, I'm always going to think, okay, does this person have high thyroid? Does this person have a medical condition that might be contributing to the irregular heart rate and high blood pressure? Keeping in mind that high blood pressure and an irregular heart rate, when your heart rate's going too fast, that's going to make you anxious. You'll feel anxious. So I'm always trying to figure out chicken or the egg, is it the heart condition that is actually causing the anxiety? There's a condition called postural orthostatic tachycardia syndrome. I just diagnosed it with a person a couple of weeks ago, and with POTS, it happens more commonly with young women, but it's a condition where all of a sudden the heart rate will go really, really fast. It's thought to be somewhat of an autoimmune condition, but the heart rate goes really fast and goes so fast the blood flow doesn't get to the head or the rest of the body, and they get very weak and they pass out. So this is a condition that is diagnosed by a cardiologist using a tilt test, but basically it will come across from a psychiatric standpoint as I'm having panic attacks. So why would a person with POTS come see me as a psychiatrist? It's because they're having panic attacks, they're having fast heart rate, they're passing out. People think, oh, they're just faking it. And some people have been misdiagnosed as having what's called functional seizures or conversion disorder because they just pass out, just out of the blue. And what they have is a condition, it's a cardiac condition that is treatable. And if treated, they can have a normal life. So it's always important that when somebody has an irregular heart rate and thereby high blood pressure in some cases, they can have an underlying medical condition that's creating the anxiety. Now, you're right. I mean, the anxiety will cause you to be more tense. It'll cause you to have a faster heart rate itself. But I'm very careful to diagnose somebody with anxiety when they have underlying physical symptoms like that. So thanks for your call. Let's go to our next caller. Hello, Maritha. Welcome to Matters of the Mind. Maritha, are you there? Well, let's go to our next email. Do we have another email up by chance? I don't think we do. Okay, Maritha, are you there? Okay, well, let's go to our next caller. Hello, Ruth. Welcome to Matters of the Mind. Ruth, you had a question concerning lamotrigine or Lamictal. Lamictal is a medication that has been around for quite some time for seizures, and we now use it for mood stabilization. Ruth, you want to know, how does it work? Well, basically, lamotrigine or Lamictal works by stabilizing this chemical by the name of glutamate, and it's thought that when people have excessive glutamate, they will be more moody, they'll be more irritable, they have trouble with concentration, and lamotrigine will dampen down the effects of glutamate and decrease the likelihood of seizures, and that's why lamotrigine was originally used. But lamotrigine is also used for the purpose of helping with mood stabilization, irritability, basically helping people with stress resilience. So basically, we tell people we give them lamotrigine or Lamictal as a means of helping them put up with stuff better. The key with lamotrigine will be that you have to gradually increase the dosage. If you give too much too soon, especially to younger people, they can have a rash on the chest, neck, or face. They can have blisters on the fingers or hands. It's about a 1 in 4,000 chance of that occurring. And it's usually occurring because they're getting too high of a dosage too soon. So with lamotrigine, we tend to gradually increase the dosage. Many clinicians might be a little bit too impatient to do that. It takes 4 to 6 weeks to gradually increase that dosage to where it needs to be. But for many people, they can get a really good effect from lamotrigine. Ruth, thanks for your call. Let's go to our next caller. Hello, Ted. Welcome to Matters of Mind. Ted, you want to know if electric shock therapy, also known as electric convulsive therapy, ECT, will it help with tardive dyskinesia? It's not highly effective for tardive dyskinesia, Ted. I know it can be used. It's been studied in that manner, but it probably wouldn't be the first choice for tardive dyskinesia. ECT is a very, very effective treatment for people with depression, for people with mania, and for some people who have manic features associated with a psychosis. So electroconvulsive therapy, ECT, has been a therapy that's been around for decades, since the 1940s actually, and it was a very effective treatment, especially when there were very few other treatments available. And then 1980s came along, and fluoxetine and Prozac came around in 1987. We've since had 17 or 18 oral medications become available since that time. So these medications have various mechanisms of action. So ECT is a means by which your brain can very briefly get electrical stimulation such that you have a seizure in the brain for up to 2 minutes or so, and you get this treatment typically 3 days a week for 2 or 3 weeks, sometimes a little bit more extended than that for maintenance ECT. But ECT has some very strong benefits, especially for depression. It increases this brain fertilizer called brain-derived neurotrophic factor. It can have a profound anti-inflammatory effect, as I mentioned earlier, with fluvoxamine having a similar type of an effect. And ECT will do some things that other treatments can't, but it doesn't seem to help that much with tardive dyskinesia. Tardive dyskinesia is basically a condition that affects the middle part of the brain, called the basal ganglia, and specifically the nigra striata. And that's the part of the brain that will affect dopamine transmission. And if you have prolonged dopamine blockade with antipsychotic medications, they're very strong dopamine blockers, you can actually bud out more dopamine receptors. So if you block neurons on their dopamine receptors for a long period of time, you'll have an increase growing in little buds of extra dopamine receptors that occur. So it makes you extra sensitive to dopamine. When you're inside part of your brain, the movement part of the brain is more sensitive to dopamine, you get twitchy. And you'll have twitchiness in the eyes, you'll have hard blinking, you can have mouth movements, you can have tongue movements. Sometimes people even have movements in their shoulders that can be problematic for them. So that we do use certain medications to reverse that process that have been helpful for many, many people. So we use medications that help reverse EC, or to reverse tardive dyskinesia, to try to reverse that process where there's excessive dopamine sensitivity. We do try to get people off the antipsychotic medications blocking dopamine to try to gradually reverse the increased budding that occurs. But nowadays, we'd prefer to use medications that are going to reverse tardive dyskinesia themselves, as opposed to using something like ECT. Thanks for your email. Let's go to our next caller. Hello, Maritha. Are you on the line now?
Yes, I'm on the line now.
Hello, Maritha. Good to hear from you.
Hi. How are you? Yes,
I'm doing fine, thank you.
To know, wonderful, Dr. Farber. I just needed to know. Can you show? Because I know you use the brain. Can you please show us how any substance abuse psychosis comes about, particularly with alcohol or opiates? Thank you very much.
With alcohol and opiates, right off the bat, substance use psychosis, for instance, what alcohol will do is basically anesthetize the front part of the brain, Maritha, and when you do that, you basically take away the judgment part of your brain. So this front part of the brain, right above the eyeball here, it's called the orbital frontal prefrontal cortex, and orbital lateral prefrontal cortex is right there. And that's the part of the brain that you use to think, should I do this or should I not? Alcohol anesthetizes that, and people do stupid things when they're under the influence of alcohol. So alcohol is more prone to causing people to have impulsive actions and difficulty with behavior, more so than opiates themselves. Now, opiates will affect these little mu receptors. There's different type of mu receptors. There's kappa receptors, delta receptors, mu receptors. Mu receptors, when you stimulate those receptors, you have a feeling of bliss. You have a good feeling in many cases. People will feel a calming effect, and they have a happy feeling. And many people, they'll get a procedure done in the hospital. They're given some opiates when they go home to make sure they don't have any pain. And next thing you know, they really like the opiates. Now, not everybody does. For many people, myself included, I'm going to say that the opiates just make me sleepy. They don't do me a whole lot of good. I didn't feel any happiness when I took my opiates when I had a knee replacement. But some people will say it was life-changing. And for that reason, with the opiates, many people actually were in a research study looking at stimulating these different opiate receptors or blocking some of them for the purpose of helping with depression. So opiates can help with depression for some people. The key is finding out for whom it's going to help and who it's not. Right now, there are no specific opiate-like medications for depression, but I would expect in coming years there might be some coming down the pike, because depending on how you affect the mu receptors, the kappa receptors, and the delta receptors, you've got to affect all three of them in a certain way, you can get relief with depression, and that will be the key. To do so in a non-addicting manner. So if you can affect these different receptors and either block or not have any effects on the mu receptors, you can have a really good antidepressant effect. So with psychosis itself, it's usually because somebody is taking such a high amount of these different medications that they're losing track or reality on that basis, Maritha. But usually alcohol makes you just not have very good judgment when you're drinking high amounts. When somebody's withdrawing from alcohol or when somebody's withdrawing from opiates, you bet, then they can have psychotic features. So a symptom of alcohol withdrawal, when you have been drinking very heavily and now you've been off of it for 2 or 3 days, you can start seeing things. And you can start having difficulty with maintaining contact with reality. And basically, that part of the brain that's affected there is this part of the brain outside here and called the limbic system. So the limbic system, when it's getting disrupted, it'll have excessive dopamine release, and that will cause you to have hallucinations when you're withdrawing, especially from alcohol. Not so much when you're withdrawing from opiates. When people withdraw from opiates, they feel terrible. They feel like they're really cold. That's why they're cold turkeys. When people go cold turkey off of their medication, it's thought that they're feeling cold and they feel like a cold turkey. I don't know whether they're called a turkey, but that's why they're called that. And they can get the hair raising up on their skin. They can get pupillary changes in their eyes, and many times they can have diarrhea. So those are symptoms of withdrawing off of an opiate itself. Thanks for your call, Maritha. Let's go to the next caller. Hello, Donald. Welcome to Matters of the Mind. Donald, you had mentioned that your wife is healthy, but is having some trouble with her memory. What can do to help her with memory loss? Donald, I'd have her assessed medically by her primary care clinician first, because if your wife is having memory problems, a lot of things could be going on there, Donald. I don't know the age of your wife, but let's just start with menopausal symptoms. When women go through menopause, the estrogen levels will decrease to this little hippocampus area of the brain. That's the memory center of the brain. With less estrogen stimulating that part of the brain, it will affect a woman going through menopause with her memory. Now, the average age of menopause is 51 years old, but as the estrogen is going down, that can be a factor. Also, especially with women, Donald, low thyroid. Classic for causing difficulty with memory functioning. So I want to make sure the thyroid was okay. Low iron, if she also perhaps has restless legs, that could be a symptom of low iron. But low iron will make a person really fatigued and they can't concentrate. Diabetes, high blood sugars or low blood sugars can all be a factor with memory itself. Now, as a psychiatrist, sure, I'm going to make sure a person doesn't have all these medical conditions. Depression can be a factor, but I want to make sure these other conditions are ruled out before I would treat somebody for depression. Many people, when they have depression, they'll have difficulty with speed of processing. They'll feel like they have slow internet speed in their brain. So their brain feels like they're having difficulty going from one thing to another. But I'm going to look at all these different medical conditions. Sleep apnea being another condition. If she snores or pauses in her breathing at nighttime, thereby decreasing the oxygen transmission to her brain at night, that will give a person difficulty with memory. So I'd want her to have a checkup with her primary care clinician first and foremost, Donald. And if depression is there, it's a possibility, but there's a lot of reasons why people can have poor memory. especially women. Donald, thanks for your call. Let's go to our last caller. Hello, Shannon. Welcome to Matters of the Mind. Shannon, you wondered if you're able to check yourself into a mental health facility or does it require a screening from a doctor. Mental health facilities, Shannon, aren't like they were really proposed maybe 3 or 4 decades ago, where they're kind of like health spas or resorts. Mental health facilities will directly treat specific medical conditions such as depression, psychosis, severe anxiety, profound difficulty with sleeping, and yes, you would need a medical doctor to be able to admit you to a mental health facility. But there are different facilities out there that are available for people to relax, and these are more health spas. And that might be something where, as when people say checking themselves into a place, they want to stay usually for 3 or 4 weeks, and that's okay. If you could, that wouldn't be a psychiatric hospital the way they are set up in the 21st century. So there are health spas out there where people can relax, and you do yoga, and you do get massages, and all those different things. And it's great if you're willing to pay out of pocket, and your insurance would not pay for that kind of experience. Shannon, thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. You can also watch Matters of the Mind on YouTube as well as short segments. I'm psychiatrist Jay Fauvre, and you've been watching Matters of the Mind on PBS Fort Wayne. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.